Hey guys, this is Morgan from Evolution Sports. I'm here today with Josh Welch. We're bringing you a video on how to perform a downslope manipulation of the cervical spine. Downslope manipulations are more helpful for kind of central and lower cervical spinal segments. Before doing any of these mobilizations, I'll generally do my lower grade mobilizations, so my grade 3s, 3+, 4s, 4+, and see what kind of response I get. If I'm still not getting the results I expect, then I'll usually go to my manipulations. When you're doing a manipulation, make sure you have 4 things. First of all, that you have confidence in what you're doing. Second of all, make sure you have training in what you're doing. This video is not enough. I highly recommend you take a class with somebody, somewhere, somehow. I did a lot of my training with Maitland, Australian Physiotherapy seminars. Highly recommend their program. There's a lot of other good resources out there. 3, make sure that you do all the proper special testing with your patients, ALR ligament test, BBI, etc., etc. Make sure you cover your behind. Finally, you want to make sure you get your patient's consent. Okay, so our downslope manipulation is a chin cradle grip manipulation where we're using side bending as our primary movement. The intention is to close down on the guilty segment, but really, you're getting a gap distraction on one side and a closure manipulation on the other side. Just depends on your patients and your symptoms, what it is that you're trying to go after. I am going to be using a chin cradle grip with my right hand. I'm initially going to assess using a key grip position, putting my fingertips in the spinous processes, and I'm going to side bend my patient back and forth. And what I'm doing is I'm looking for movement in the cervical vertebrae to see where I'm lacking movement, what corresponds with my patient's chief complaints. My thrusting knuckle is going to be the same knuckle that does my assessment. I'm using the second metacarpophalangeal joint on that finger against the articular pillar. Okay? And so once I identify which level I'm working at, I'm going to place my second MCP joint against the articular pillar. I'm going to side bend my patient against that knuckle until I feel movement at the level that I'm going for. I'm going to add extension, a little bit of rotation to tease it up, and then I've got a side bending manipulation. Okay? So you start with side bending, you add extension rotation, you finish with side bending. I'm going to go ahead and sit my patient back up. We're going to assess range of motion, see what's changed with the signs and symptoms compared to his pre-manipulative symptoms. I'm probably going to follow this up with some spinal stabilization, postural re-education. Thanks for joining us.